anytime I've had this conversation with a patient, I'm very, very cognizant of the fact that I'm about to say something that could be interpreted in the form of, oh, you're telling me that this pain is in my head. Well, I always say this, and it's true. Like, everybody's pain is in their head. Okay? That's how we experience these sensations. So nobody should feel like there's an implication that you're making this up. Everybody, if you're experiencing it, you're experiencing it. Okay? So I'm taking that on face value. I never deny anyone's experience. How could I do that? It's their experience. Of course the mind can do that. The mind can do anything. All of our experiences are ultimately created by the mind. So I say that because then I know there is this feeling like you don't believe me or you're thinking that this is in my head. It's always in your head, and no, yes, you're experiencing pain. And if the pain is severe, you're experiencing severe pain. Let's not deny that experience, okay? Hi there, Health Feast listeners. Dr. Rak here. And super excited to have you back for another episode of the Health Feast. In a moment, I'll be joined with Po, but I wanted to give you a little bit of a preview of what we'll be talking about today. So we're going to be talking about chronic pain. And that is generally pain that you've had for longer than 2 to 3 months. Now, most of us, almost all of us, have dealt with pain and probably have dealt with pain that we've had longer than 2 or 3 months. And some of us deal with pain for much longer than that. And pains that sometimes seem to come and go and come for no reason, even without an injury, even without some preceding event. Or sometimes we did have an injury, but it was years ago, and the same pain will flare up. So Po and I get into what the underlying causes might be of chronic pain. And we sort of do a deep dive into what modulates pain. So what makes it go up and what makes it go down. There's physical aspects that we talk about, the psychological aspects, and also the social aspects of pain. And I lead Po and all of you through a breathing meditation that you might investigate and nurture your pain with your breath. So I'm super excited for you to join us on this episode, and I hope you find some relief, whether you're walking your dog, maybe ending the day, commuting home, heading up to bed. It's a perfect time to curl up, listen to this episode of the Health Beast, help you optimize your life by getting a handle over your chronic pain. So let's do the show. Po, you've been, okay, yeah, I pulled a muscle last week and that's getting better, so I don't really want to focus on that. But I have had some pain this week, and actually it caused me, has caused me to think about you, because I know that's something you've been struggling with.
Yeah, especially compounding pain. Like I've never been someone that would consider myself having chronic pain. I mean, I just, I don't know if that's a mixture of like obviously the injury, but then also like getting older. Like my body is not, the same, and being overweight. That's another thing. So I'm just like, it's funny. I was just talking about my back pain. Like, I feel like I'm just experiencing different areas of my body dealing with not only the injury pain and the aches, but then other body parts inflamed and just sort of causing this ripple effect of pain throughout my body. And, dealing with the mental side of it, it's like you're dealing with, not only are you dealing with the injury pain, but now you're experiencing like sort of this compensated pain where, if I'm walking a certain way, it's, the body is trying to make up for that. And so now all these different things are starting to happen. I mean, because I've had pain just localized into one area, but lately I've been feeling pain in multiple different areas of my body. And I've never been a person to like have experienced this. So it's sort of new, trying to understand it and trying to pull myself out of it because
Oh, you're having pain. If I hear you correctly, like you've had pain in areas like where you had surgery and injury and gout, but
yeah,
now you're also having pain in other areas and that are new and for no clear reason, right? It's
yes,
not like you had an injury.
right.
And so you're asking, like, why am I getting, and where, for example, is an area where you're getting that kind of pain?
Lower back, right
Lower
above
back.
the yeah, lower back, right above the glute. I was, like the pain is like it radiates to the front. It doesn't necessarily go down my leg, but it
Yeah.
goes to the front of like almost like right above my hip.
Mm.
So,
And
and
as
it's
far as you know, no injury to that area. You didn't have
no,
any fall. Okay.
yeah, because yeah, no, that's
Okay.
not that I'm aware of.
So, yeah, talk to me about, I mean, I would love to explore that with you, and sort of the mind body connection of
Yeah,
pain. Is
yeah,
that something you'd be interested
yeah.
in talking about? Okay, well, maybe I'll start with that, and then we can explore your pain more in the context of that. For our listeners and for you, Poe, once anytime I've had this conversation with a patient, I'm very, very cognizant of the fact that I'm about to say something that could be interpreted in the form of, oh, you're telling me that this pain is in my head, or you're telling me that I'm, for some reason, like, and so I want to say from the outset that, well, I always say this and it's true, like, everybody's pain is in their head. Okay. That's how we experience these sensations.
Mm,
So nobody should feel like there's an implication that you're making this up. Everybody, if you're experiencing it, you're experiencing it. Okay. So I'm taking that on face value. I never deny anyone's experience. How could I do that? It's their experience. So that I want to be clear about that. And I love this little story about, like, and I don't, I don't know how true, but this happens. I'll tell you, like, somebody, man, let's say at a construction site, man or woman steps on a nail. Okay, nail goes through the shoe, and guy is talking to someone. It's a really loud construction site. Doesn't even notice. Doesn't even notice. And then somebody looks down and says, "Hey, man, there's a nail in your shoe." Well, the guy looks down, and then in that moment, like, starts feeling this stabbing pain in their foot. Okay, so right there, like, the pain didn't register until the pain registered here in the brain. Okay, so pain
mm,
has to register in the brain. Brain then sends signals back to that area, and then it communicates such that it feels painful, and then it's experienced as pain. There's a twist though, Poe, because we take the shoe off. Man takes the shoe off. He's freaking out. And there's no blood, and it's just gone through the shoe and not his foot. And his foot is perfectly intact, right? There's not even a hole in the sock. And so then what caused the pain? Right. So mind can do that. Of course, the mind can do that. The mind can do anything. All of our experiences are ultimately created by the mind. So I say that because then I know there is this feeling like you don't believe me, or you're thinking that this is in my head. It's always in your head. And no, yes, you're experiencing pain. And if the pain is severe, you're experiencing severe pain. Let's not deny that experience. Okay.
got it.
Anything coming up for you when I say that?
No, well, number one, it's the explanation of that is awesome because when you're dealing with a medical, like different medical professions, right? Like going to physical therapy, and they see you coming in, and then when you start expressing another form, I'm sure from the person that's receiving the information, it sounds like you're making things up, and that's
Hmm.
the frustrating part. And then
Hmm.
it's and then you start reflecting on that, like, man, I'm sure, and being that I've never had experience like this type of pain, and also like not even this type of pain. I've always had aches in my back here and there, but it's the compounding It's like one thing after another. It's hard to not let that affect your attitude. Like it's extremely challenging for it to affect. For me in my experience, it's like when I have a painless morning now, I feel like it's a great day, and then I start planning. Okay, this is what I need to do. Get into a plan, get into a groove to start getting better, and that means
Mm.
physically, mentally, spiritually. You know, but then when another body part starts flaring up, it's just like another hit. So that's why I wanted to talk about pain and how
Yeah.
okay, so most of it is in the mind, but then how do you
Well, okay, so pain starts in the mind, right? That's the experience of pain. But pain is, I would say, three things, okay? Pain is biological or physical, okay? So that aspect of it is a physical aspect to pain. And then pain, and that is often what we, in like Western medicine, we often just focus on the physical aspect of pain
Mhm.
and the biological aspects of what might be causing the pain. Pain is also psychological, okay? In that way, we're saying like the pain I'm experiencing is in my brain. The way you can think about it, Poe, is, as it's been described, sort of like there's a pain dial we all have, okay? Why is it that some people can have the same exact injury or accident and experience, or the same surgery and have wildly different experiences?
Mhm.
The same bone was cut, the same nerves were affected, and this person is having, right? So there's a psychological aspect to pain. There has to be. Of course
Mhm.
there is. But we don't even acknowledge that half the time.
Wow, and there's no training for it either, even from a physical therapist perspective either. Like
Not at all.
because they don't really like. Oh, well, I shouldn't say they don't, but I'm saying like not everybody includes that information into someone who is experiencing critical like chronic pain. Does
Yeah,
that make sense? I
that's
mean,
right.
I could hear it in the my physical therapist's conversation with me. She was just kind of like, you got to be able to pull yourself out. She was aware of it, and she was giving me some data about what she's experienced with dealing with folks who have been injured on or off the job. Which I thought was really interesting, and that she notices that people that are injured, and this is based on her experience, not like I don't know what the numbers are, but that people who injure themselves on the job take a little longer to heal versus people that do it when they're on their own time, which I thought was an interesting kind of thing. When I was listening to her, I was like, wow. So that's when I started going down the whole mindset of like, man, am I creating this in my mind? You know what I mean? Like, but then I know that's not true because I'm experiencing, pain.
Right, right,
uh,
right.
but I can see if you work in that line of work, how it can be taken advantage of. 100%. You know.
So I'm going to I'm going to assume that everything you've told me and you're talking about is your true experience of the pain. Okay.
Yeah.
And so go back to it. Pain is physical, it's psychological, and it's also social. So that's the,
Mm-hmm.
so this, and by the way, this
Good.
kind of characterization of pain I take from Dr. Rachel Zoffness. Rachel Zoffness is at UCSF, where I did my training, and I heard her speak. I think it was about a year ago about kind of, and that's what she does is she helps people manage chronic pain. And I'd never heard anyone describe pain in this way, right? Where there's this clear physical part of pain, but there's also this biological, the psychological, and then the social aspect of pain. Social aspect of pain, we particularly see that she gives the example I remember during her talk where you have, for example, a child who's having pain, and the anxiety and the kind of heaviness that the parent brings modulates the pain. So you have parents who are very calm and kind of adaptive, and then you have parents who are very high strung and anxious, and you can see the child's pain is modulated by that. But that happens in our lives too, right? The people around us very much can modulate our pain, right? By affecting our the stress in our environment, and again, it's not something that we typically think of when we think about how to manage our pain, or what might be cause is something we'll get into, but like what might be aggravating our pain, right? We always jump to the physical. So, oh, my pain is worse today. it must be because I slept on it funny, right?
Mhm. Yeah.
Not, and it's like, no, well, actually, likely, I mean, that may be the case, but also possible is that there are some psychological factors that are making my experience of my pain a little bit more pronounced today. Or there's some social factors that are making the experience of my pain more pronounced today.
That's interesting because I was thinking of social as, you kind of withdraw from because of experiencing pain. Like I've made decisions on not,
Mm.
going to social gatherings because of sometimes it's because I'm on crutches, like dealing
Mhm.
with my surgery and my leg. And then I'll choose to be sort of like, nah, I don't want to put the burden on having to crutch around when I'm on the crutches, So I would withdraw from social events. That's what I thought you were talking about. The social.
Yeah. Well, no, the social aspect of pain is that, I mean, social isolation because of your pain can also potentially modulate the effects of the pain. Like you may feel more lonely or depressed, and that may have a
Oh,
psychological
yeah.
impact. When we talk about social modulation of pain, it's really like how the people in your environment might be
Mm.
modulating your pain. So that could be the people you live with.
Can you talk more about what modulating for the audience? Because I'm trying to understand.
Modulating, yeah, like think of it like a dial, Poe. So
Okay.
think of it like I have a pain dial, and
Mm.
I'd be experiencing pain from 1 on one end to 10 out of 10, like the worst pain I've ever experienced. Now we usually think of like that as like in any moment you could rate your pain, but that's constantly changing,
Yeah.
right? So an hour later, depending on the physical circumstances, the psychological circumstances, and the social circumstances, who is in your environment, your pain may be much less, right? So I was on this ruck hike on Friday, and for my first time going with a group of guys, and I halfway through, somebody said, because I was just talking so much, and somebody said, "Oh, like it's going by much faster this time
Mm.
compared to last week or something. Thank you for that." Like my mind is distracted, right? So I'm not. People
Mhm.
often say their pain is worse at night. I think that's often because then you're just still and you're able to kind of like focus on, or you tend to then focus on that sensation because there's nothing else going on. And so that's what modulate means. It means your pain can change moment to moment, but we're recognizing that it's not just the physical aspect. In fact, the physical aspects don't change that much from moment to moment. That's actually what changes the least from moment to moment. It's not like you're re-injuring the area, or I mean, now certain movements might aggravate it, but that's very different. And so, yeah, it's the thinking about the psychological aspects that might be increasing or reducing the pain in that moment.
Yeah.
Oh, something keeping me distracted, something that that making me joyful. I'm less likely to experience the severity of that pain in that moment. It's interesting, but it's true. You've experienced that, I'm sure.
100% have.
Yeah.
Yeah. I know exactly what you mean. Like a few days ago, if you would have talked to me, I was at like a 10 pain, like barely can get out of the bed because of just the back. And then as time went on, I started playing this mental game. Like, I just getting frustrated, dealing with pain is frustrating. And then I'm just like, man, I need to start doing something proactive that I can get myself out of it. And I feel,
Hmm.
so yes, adding changing the mindset of like, okay, I have to deal with this pain, but now I need to start doing things that make me feel better. So I
Hmm.
started noticing that if I stood up and I stood standing and walking helps the pain,
Yeah.
it just kind of goes away. So I
Hmm.
started doing that. I just
Hmm.
set my timer for 5 minutes and started walking around my house, do what I can, what I know the pain, it kind of alleviates the pain. And then, one thing led to another. And now, like today, we're talking about it. But like as I'm talking to you, I think when we're laughing, I can feel the jolt in my lower back. But just the conversation, I'm not
You're
paying
not
attention to
fixated on
it.
the pain.
Yeah, yeah, yeah.
Yeah. Same here. I have some pain I've been dealing with, like I said, and I'm not thinking about it at all during this conversation until if I start to bring my attention to it, I'm like, oh yeah, it's still sore. It's still tender there.
Mm.
I can start touching that area, and then I'm like, oh yeah, it's sore. right? And then I'm starting to experience the pain again. But
I just wanted to say, but also you also chose to go do something to distract you by going on the hike. And I'm sure if it was really severe, you'd probably go,
yeah, I wouldn't have done it.
yeah,
Exactly.
yeah, yeah.
Yeah.
But you
Yeah.
knew
Yeah.
that it
Yeah.
was at a certain level of that pain
Right.
meter that it was enough for you to just get a
Enough for me to go through it.
right,
Exactly.
right.
So let's talk about the those. I want to talk about physical and psychological in particular. So from the from the physical aspect, Po, why do we? I'm ask you this: like, why do we even have pain?
Me, for my definition is it's your body communicating to me.
Mm-hmm.
It's my body saying, "Hey, something's not going on. Something's not right in this location." So that's how I experience pain, is,
Something's
or at
not
least in
right.
my body. It's like a way that your body sends you an alert, like it's like notifications. You know what I mean?
On your phone,
On your
yeah. This is
phone, yeah.
like a form of notifications. That's interesting. Yeah, I like that. I think you're right. It is a notification system. It's a warning system, actually.
Mm.
In many ways, it's like, there's danger either emanating from the place that caused pain, or now in your body there's something healing, and you need to pay attention to that so that the healing can occur, right? Either way, it's like a warning. It's like if you touch something hot, your brain remembers that it feels very hot, and you're warned not to do that again. And so pain, we evolved to have pain because there's a protective survival element to that, right? So if you're able to protect yourself and use that warning system and heal after an injury, for example, heal properly, then you're more likely to have offspring that continue your lineage. There's a survival aspect to having pain. Now, but
Mm.
I think pain can go wrong, or it can be kind of co-opted. And so we'll get into that. But the physical aspect of pain, like if I break a bone, like last year I broke my wrist, you injured your knee, your ligament needed surgery. The pain you experience right after that is the acute pain that you would get from an injury. Those are all the nerves in that area that are now like firing like crazy. And they're doing that to also protect the area, right? And it's not just the nerves, like the muscles are seizing up in the area. Everything is working to try and protect that area and to tell you, you got to kind of stay off this, right? And so, depending on the degree of injury, you're going to have pain, physical pain, from acute physical pain and subacute physical pain for several weeks, couple months, 4, 6, 8 weeks. Okay. And about that time though, most injuries heal. Okay. Now there's a difference if like you then get surgery in that period, and then, then you got to restart the clock potentially. But within 2, 3 months, most of these soft tissue injuries, our body has actually healed. And that's when the pain we start to think of becomes kind of chronic pain. And the physical nature of pain, when it deals with acute pain, makes sense. There's a warning system in place, and this is something healing. After the healing is done, the signaling of pain doesn't really make as much sense. What are you warning me for? Why are you continually warning me when there's nothing? And so this is where I think then the psychological aspect can often take some control over that experience. I don't know. That's
No, I'm just totally soaking in what you're saying. I can see that. I can see how the body can only give you so many signals, and then so I guess I go back to what I'm saying. Like, it's really difficult for, like, literally in weeks, like, back to back issues with different
mm,
things.
yeah.
And I'm not talking like 1 month this was happening. No, I'm talking like the moment I'm done dealing with one set of pain,
Mm,
I like a new thing starts
mm,
up. And that's why, I was just telling you earlier about how I've never been in this situation before, and it's new, and learning about chronic pain, learning that it, just going over again how pain is interpreted and how pain is, it's helpful for me to, sort of start planning on, okay, I really got to do one thing at a time. I can't really do everything at once, even though it feels like that. It feels like pain is like, and it starts affecting my mental health because it's frustrating taking two steps forward and then, taking a step backwards. But I think the way you're framing pain is like just remembering to understand the connection of what it's about. And you know what? Now that I think about it again, is like, dude, the injury caused me to be immobile, and then now, I'm trying to compensate because I'm still, not fully strong in one leg, and then we can talk about. I know you bring this up to me a lot, and I'm thankful for it, even though I don't want to hear it. Talk about food, like what are you putting into your body, and that.
How does that modulate the pain?
Yeah, yeah. So it's all relevant.
Well, you bring up a really important thing, which is, chronic pain, like say somebody has arthritis,
Yeah.
is still really mediated by inflammation. And so you can get x-rays on someone, you can see that they're bone on bone. Often we'll hear people, but I've seen x-rays of people who are bone on bone who have no pain. It was done incidentally, or they have some mobility issues, but they don't experience any pain from it.
Mm.
And so again, it goes back to, well, the physical aspect. I think it's great that you're saying it isn't just what is the physical injury or what is the physical component of the pain, where is the anatomic location. It's also what is the physical environment of the body. Are there other things in the environment that are causing an inflammatory reaction within the body? And food is the biggest, but lack of sleep, people's pain will be worse when they sleep less. Sugar and refined
Flour.
grains are really interesting because they have an analgesic effect, Po, meaning they actually, when you're eating them and for a short while after, they have the effect of kind of dulling the pain. But then there's very much a
Spike.
spike back afterwards. So unless you keep eating that to dull it, you're gonna have these ebbs and flows and spikes in pain. And right, but that's becoming aware of, and that is to say that's power. That's powerful, right? Is that, oh wow, I can eat,
Yeah.
like a couple cinnamon buns or a couple donuts and actually feel a little better. And sometimes that's all we want, is just a little bit of relief. And so if that's going to give me a little bit of relief, so I've been there. I don't blame people for that. It's just not a sustainable or actually very effective therapy, right? That's what I want to point out is, okay, so what is a sustainable and effective therapy if you're in this situation? One is making sure, there isn't some physical problem that needs to be addressed. I'm getting into the realm now where it's like the physical has been addressed, and we're now weeks to maybe a few months after the injury, or there was no injury, right? There was no injury. There's just this pain. And I used to get the no injury pain a lot. I would get upper back pain, so debilitating that I had a hard time and I would get pain in my hip and no injury. Sometimes you tell yourself like maybe this is overuse, or maybe you start to come up with stories, but we really don't have an explanation for it. And Po, one night my pain would get so bad. This was like 6-7 years ago. And certainly my diet didn't at that time support,
Yeah.
but I had no injury and I was in my mid 30s. So no reason to have all this pain, but I would come home, my kids, I would have them like stand on my back sometimes because it was just so tight and tense. And I didn't know. One night I was I was always Googling like back pain and things like that. I tried different things. I bought different massagers, and Amazon, the first book that comes up was this book called Healing Back Pain.
Mm.
And I clicked on it thinking, okay, this is going to be another like physical therapy, some sort of set of stretches, but it had thousands of reviews, many thousands of reviews, and it was like almost 5-star. And I said, what is this book, right? And so it was written by, have you heard of this book, Po? I don't think we've ever talked about this.
No.
Okay, so it's written by a physician. He's no longer alive. John Sarno, MD. He was, I believe he was at Columbia. He was PMNR, physical medicine and rehabilitation doctor, a physiatrist. Physiatry, you may have heard of that. It's like rehab medicine.
Mm.
and they focus specifically on people. A lot of times, not always, but some of their kind of patients will have chronic pain, or it's often chronic rehab after an injury or a stroke or something like that. But he had seen so many people with chronic back pain for no clear cause. They did a really interesting study. Some group, in the 90s, it was published in the New England Journal of Medicine. He writes about this in the book, where they got MRIs of people who have back pain and people who don't have back pain. And what they found, and this was a large series, what they found is that the findings don't actually, what you find on MRI doesn't tell you anything about whether or not somebody's going to report back pain. So you see some people with slip discs and compressed discs and all these things that didn't have any reports of pain. And you see other people who don't have those findings who are reporting chronic back pain in different places. There's really not an association between those findings and so
Wow.
and that was a random study where they sort of like said, okay, we're gonna have this group of people get. So then what causes the pain? And I go back to, there's the physical aspect, but there's also the psychological and social aspects of pain. And those are things I had never really confronted in my life. And to think that, oh, maybe pain could be manifested and created and then manifested from psychological factors. And before I tell you what kind of Sarno talks about those psychological factors, I want to pause and see what you're.
I'm totally curious about this. I really want to learn a little bit more about it because then I just, I feel like with that information, I can sort of like reflect on it and maybe start. I think it gives me more like, I guess I could use the word hope because then it's like,
Yeah,
okay,
please.
you know what I mean? Like, if these are some of the studies that have come out and past people's
Yeah.
research and stuff that I can like,
How do you
yeah,
move past? Okay.
yes,
So then the book is really great. It's really short. You can read it or listen to it, but I'll summarize um, kind of what he talks about. So Sarno goes on to then describe. He comes up with a name for it. He calls it tension myoneural syndrome, or TMS. TMS. And what is TMS? He says TMS is basically your brain is reducing blood flow to certain parts of the body. How does it do that? Because the brain can do anything. It can constrict blood flow anywhere. It can, change the chemical nature of the blood. All of this can happen. It can change how we breathe, within has like changes the chemistry of all the cellular functions in our body. So imagines like the muscles in the low back, they're getting slightly less blood flow. They're gonna become more tense and seize up and cause some discomfort. Why would the brain do that? So then that is to say there is a physical nature. You can, for example, people who have fibromyalgia. Have you heard of fibromyalgia,
yeah,
Po?
yeah. Don't know too much about it, but I've heard of it.
It's a chronic pain condition where people get pain in many different areas of the body. There's a certain number that you have to have, and it comes and goes, but it's very debilitating. And John Sarno treated hundreds, he treated thousands of patients with chronic pain throughout his career, but he frequently would have people come to him who had fibromyalgia. In the studies that look at what's going on at the level of the muscle in fibromyalgia, they've done biopsies, for example. They see decreased blood flow to those muscles. There's this constriction and getting less blood, less oxygen. So then they seize up, and that's happening in multiple places in the body. Okay, this is what's happening in fibromyalgia. And Sarno would tell you that, as he wrote, that is just a severe, severe manifestation of TMS. And, it can and he says the most severe manifestation in the moment is when somebody has a spasm, right? And it's like, so
Contract.
why?
Yeah.
And then the next piece of it is like, why does this happen? Okay. And this is where Sarno starts getting into sort of psychoanalytic aspects of this, right? And so he talks about our subconscious mind, just subconscious mind, which is actually like, we get all this information fed into us all the time, but we're only aware of a very, very small amount of it, right? That's our conscious mind, the things that we're aware of. But there's so many things happening in the background, Po. Most of it, almost all of it is happening in the background. And then it's certain parts of our brain that are picking out, is this important enough for me to bring this to conscious awareness? So it's like if you ever bought a new car, you'll start noticing models of that car then everywhere. And that's because you were always seeing them, but you were never bringing them out into your conscious awareness. And so there's a programming system, an operating system underneath all of this that is deciding what should, and we can actually tell ourselves too, what's important, what should I, your name is a great example. So from a very young age, you learn your name, and then that becomes the most important word that you know. And so you could be in a very crowded room and somebody might be yelling your name amongst the cacophony of all the sounds and yelling and whatever. You'll hear your name, you'll pick out your name, even if you aren't listening for it. So, so we can train ourselves to look out for things that are important and not important. And in that subconscious mind, we're dealing with a lot of emotions. Oftentimes these are what then is described as repressed emotions. So these are emotions or feelings that we have just like on a kind of higher level, our brain is trying to protect us, like our subconscious mind is trying to protect us. Let me keep these hidden in the background, because if I actually make him consciously aware of these things, bad things might happen. He might do something in response to this. It's better to just keep it. And how do we then continually repress emotions? And this is where Sarno says the brain comes up with distractions. And one of the best distractions is chronic pain. So I don't want you to think about the rage you might be feeling towards your children or towards your colleagues. I am going to distract you. I have a great distraction, something you're going to think about all the time. You can keep your mind off of that. And that's it. And he developed an educational program where he would have people basically watch a series of lectures about this. And many, not all, but about half the patients, their pain would either mostly go away or completely go away just by learning about this. They didn't even address the underlying emotions. The interesting thing is, as Sarno would say and write about, is that once you sort of like pull the wool off, what's the expression?
Pull the lid off, or
pull the lid. I know, whatever. Blow the cover of this little room that your subconscious mind is doing.
Yeah.
Then it doesn't work anymore. And so I remember when I read the book, it was like a Friday night and I had to work that weekend. And my wife also pointed out to me at the time, she said, your pain always seems to flare up like right before you go back on service. And I would work in the hospital for like a week, sometimes 10 days, sometimes 2 weeks in a row. And then I would have some days off to kind of recover in between. And it would often follow that cycle where I was just like, going in, and while I was on the job, like often the pain would go away. I think I was really distracted. It was really like right when I would get done, like it would kind of flare up, and then when I was going to go back to work, it would often flare up. And she noticed that. And so I was listening to the book and I was like, okay, this is interesting. And he doesn't really give much in the way of kind of tips on how to change this. I did find some really good resources. I can share them in our show notes too. There's like basically an online webpage that, thousands upon thousands of people have greatly benefited from his work and thinking about pain in this way. And they've recovered from chronic pain. And so some people created a free website, which is it's called TMS, which is his syndrome, Wiki, Wiki. I think it's .org. And they've created like free resources to basically like process this type of pain through your emotions. And there's journaling exercises and things like that. Anyway, back then I didn't know about any of that. And Sarno basically would say, just tell yourself, like have this self-talk with yourself. So I started doing it that night and the very next morning, like on the way to work. And it was like, brain, I know what you're doing. You can't fool me. Like this isn't working. Like there's nothing. And you have to reassure yourself, there's nothing wrong with my back. I didn't have an injury. You don't need to warn, because that's also reassuring is this on the on some level, we're also worried. We're like, oh, maybe there is something wrong with
Yeah.
my.
Yeah.
And then that reinforces, your brain says, oh, he's worried about it. Perfect. Because that's why I have pain. It's a warning system. So I'm going to make that area hurt because he's worried about it. So it almost like fulfills on itself this idea that, I think something might be broken. The brain says he's worried, he's scared about that. Let's make that hurt. And so I was doing the opposite. I was telling myself, there's nothing wrong with my back. I didn't have any injury. My back is strong. And within a day, like actually I woke up that next morning and I would say the pain was 30% better. And that says, okay, maybe, but usually it was much worse in the morning. Usually on the day I was going to the hospital, it was way worse, but it was manageable. It was comfortable. I think I didn't even take ibuprofen that morning. And then I was going to work and saying these things to myself the whole way there. And Sarno says something really interesting, which happened to me. He says very often then the pain will get worse. And it's sort of a last ditch effort of your subconscious mind to say, no, 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 no. I'm going to make this distraction work. And I remember going through a couple days where I was just having such severe pain. And it's like, actually, I'm glad I knew that might happen. After that, the pain sort of subsided. It definitely, I still get pain like that once in a while, not like I used to. And when I do, I go back to the same techniques. I tell myself there's nothing wrong with it. Now, this is very different than if you have an injury. I broke my wrist last year. That was very different. Obviously, there was an acute injury and but once pain, like I said, goes on beyond a few months, you ask yourself, is there something I might be repressing? And I had to ask myself that too. And I did have rage. I had rage towards a lot of things in my life, not stuff I wanted to act out. I didn't want to act out on any of that stuff, but I had to acknowledge that it was causing me a lot of distress. And in doing that, and then saying, like, I don't want it to manifest as pain and discomfort. I just want to acknowledge it. And that also calms your subconscious mind down. It's like, okay, maybe I don't need to do this anymore. Maybe he's not going to like act out on these emotions. Maybe I was worried for no reason.
It's very interesting, man, to learn all this. You know that? Because now it just gives me the ability to be aware of what's possibly happening with my body. Like when you're in the pain and you don't have this sort of information, you're literally just for me, prior to this conversation, I was just trying to figure out what's going on.
No, good. I'm glad we're talking about this because it
Well,
requires
it's
this
interesting
kind of
because
nuanced conversation.
yeah, well, remember I was saying, like, for our audience before our podcast, I was like, he asked me how I was doing, and I just said, look, man, because this is the other social part of it too, is that you don't want to share, because especially when you're dealing with an injury, it becomes like the same, you know what I mean? And for me, it's like,
You become the Debbie Downer.
yeah, like I'm
And you
always
don't
like,
want, yeah, and you're
yeah,
like, I don't want, yeah.
which is partly why, like, and I mentioned this, like, you kind of isolate yourself, you kind of like, man, nobody wants to listen to you talk about your pain. And especially for someone who hasn't been dealing with this type of pain ever. I mean, I've injured myself, but I think I've never had like a situation where it's like compounding,
Yeah.
And that's
Well, Pro,
probably the thing to change my mind about, is that instead of looking at it like that, each pain source is an individual thing to look to think about and to
yeah.
reflect on.
Because some of it is certainly physical, right? If you're having
Yeah,
a gout flare, that's physical pain.
yeah,
And that's like a warning system for a reason that,
yeah,
now if you're having like chronic pain from a prior injury, the subconscious mind, the brain loves that. It loves when there's a story that it can get you to believe the pain. This is what Sarno says. He says, when people get like an x-ray that shows some abnormal finding, again, it doesn't really, or an MRI that shows some abnormal finding, it doesn't really correlate with the pain, but the brain loves it. It's like, okay, now I can really get him to believe there's something wrong, there's something broken. And so you think about the narrative that you're telling yourself about the pain. Do you believe that there's something still wrong, still broken in a chronic injury? Do you believe that it's versus no, you tell yourself it's healing, it's getting stronger every day. So you just be intentional about that message you're sending yourself, because that'll create an environment for that healing to happen.
Got it. Yeah, there's so many ways this can go. Like, there's so many
Well,
ways this can go because now, like, when I'm thinking about it, like even, and I'll just cover a little bit of it, but like, so when you go to a doctor and something's wrong, but then the doctor doesn't believe you, and then
mm,
they do an MRI and it shows that what you're feeling, it confirms that. That's
mm.
why the whole patient doctor relationship is really, like, obviously this is not you, but I'm just saying, like, in that situation,
Yeah.
what do
Well,
you
I want to be clear. Like what you went through, like where you had an injury and then you were experiencing pain, and then the MRI showed something. It showed the mechanism of injury. That's very different than somebody who suddenly, or has this, like I was getting upper back pain,
yeah, with no
or even
injury.
now you're getting low back pain. And
Yeah,
it's like, well, what's bringing out your low back pain? And so you just said it. You said that all your pains are not being created by the same source. Some might be physical and affected by psychological and social aspects. Some might be predominantly psychological and
yeah,
affected by physical and social aspects. And
yeah.
so, it benefits all of us to just ask that question: what might be causing this pain? And have an open mind and a curiosity that it might be, certainly can be, something beyond just the physical.
And that's what I think this conversation has been eye opening for me. Is just looking at pain in a different lens versus, and most people don't know this information, Rock. That's just the honest
Yeah.
truth. Like, most people don't know how to break down pain like this. You
Well,
know,
how do we treat pain, Poe? I mean, I think in Western medicine, we reinforce the narrative that pain is physical, because we treat pain with medications that blunt the physical effects of the pain.
yeah, it only covers the pain up, doesn't necessarily
Yeah.
fix the problem. Yeah.
Now, I mean, sometimes there's efforts to remediate the physical cause through, like, physical therapy, for example. Again, that's addressing the physical. So there's so much emphasis. Almost all the emphasis is on physical. And then when we bring up the psychological aspect, there can be I started the conversation by saying I've noticed when I talk about it with patients, there can be a defensiveness, or
Hmm.
and it's like, why is that? It's because people are often used to that being used as a kind of reason to not believe their pain, or to say that it's not actually as distressing as they're saying. And that, no, 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 no. In fact, that distress is originating from there. So if we don't address the psychological, we're never actually going to get meaningful improvement.
Yeah, I hear that. Yeah. Well, just having the information to understand that it could be coming from a psychological standpoint, not just the physical. Mind you, now, before the conversation, most of it was for me thinking, like, man, it's a physical thing. Like, I'm experiencing these, pain alerts, notifications. But now
Yeah.
you're saying, but it's also, being open and curious about, well, why. It just breaks down the why it's happening, and then
Mm,
just us
yeah.
discussing it, it's like, well, it's not necessarily, you know a compounding thing, which is what my narrative is saying. It's like, it feels
Yeah.
like one thing after another. But after this conversation, I'm thinking, well, maybe it's not. What else am I feeling emotionally, mentally? Like, what's going in? Prior to the conversation, I wasn't really, I
Yeah.
wasn't really focused on that. I was mostly focused, like, what's going on? Like, I always try to look at, why am I experiencing all this pain at once? Right.
Yeah.
And I think this is the answer. You're like, what we're talking about right now is like, well, let's not bundle it in a package. Let's
Yeah.
just break them down individually, and then try to examine, okay, what's going on, for these pains to become happening all at once, it feels like. Or maybe that they're coming, like, all I don't know how else to say it, but like, I feel like it's happening every week. I'm experiencing something
Mm.
different.
The other thing that really can help, we're talking about modulating your pain, is just then trying to intentionally activate your parasympathetic nervous system, like the nervous system that tells you you're in a state of calm, usually a rest and digest, but it also has the effect of then de-amplifying or decreasing those harsh pain signals. So the best way to do that, Po, we can do it right now, is just sit up, put one hand on the belly, and then rest your shoulders back. And take a big breath in through the nose. Really feel the belly filling up, and then let it go. Take a breath in. This time you're going to go in the belly. And then after the belly, or maybe the next breath, you feel it go a little bit in the chest too. So belly fills up and then chest fills up. And then you let it go. Po, are you having any pain right now?
Yeah.
Where are you having pain?
In the lower back.
In the
Like
lower back.
when I go to breathe in, I can feel the jolt in that area, but I'm just trying to be aware of it while I'm doing
Okay.
it right now. Like just
Let's
acknowledge
do
that.
this. Let's do this. Yeah. I want you to just as you take that breath in, so just breathe into that area that you're feeling the pain. Imagine that the air that you're breathing in is just kind of going to that area. You can visualize it as like having a light, or like a blue or like a glowing light. You're taking it in, and it's just going to that area. And when you breathe out, there's tension that's just leaving. So let it all out completely. You breathe in. And breathe out. I say breathe in peace and love. And breathe out stress. And breathe in joy. And breathe out pain. If there's any pain, just try to just sit with that sensation and see if it's affected by your breath.
Rock, it's actually slowly going away.
Yeah.
Well,
Yeah.
Rock, I mean, we could probably do this all day, but I could tell you
We could do it all day.
in the 2 minutes that we did that, like the pain level kind of went
Yeah.
down. Like the first few breaths, it wasn't used to that. I feel like my stomach expands and
Yeah.
hitting something back there, right? And then as I let go and I just kept just breathing in, utilizing what you were saying, kind of imagining that I'm sort of just being aware of the pain. It's very, very similar to just meditating in general.
Yeah.
But
Yeah.
I can feel like right now, the pain kind of just slowly, like a dimming of a light, like a
Dimming of a
dimming.
light. It's just the
Yeah,
pain dial.
yeah,
We just turned your pain dial a little down. And we did that with like a minute of deep breaths. Exactly.
yeah.
So
That's
and this is empowering. I taught a patient of mine this last week on a call, and she has chronic jaw pain,
mm,
TMJ. And she said, my jaw has never felt this relaxed, and I don't remember how long. And I said, isn't it amazing that you have that powerful medicine with you at all times?
yeah.
Yeah.
It's very interesting because as I'm doing that, I'm reflecting on how often I do that and I don't. And I think about all the stresses of just life in general. it definitely can be. I'm now a believer that there is something that is connected to the stresses, the anxiety, whatever that is, because those are, in the breathing exercises, I could feel, especially when you're focusing on it and then allowing it to, you're aware of it. So it's acknowledging that the pain is there, but sort of like breathing into it versus resisting it.
Don't exactly. You're not resisting it. You're actually
Yeah.
allowing it to be, and in doing so, it it softens.
Yeah. It's not as acute, I would say,
Yeah,
because when we first started, I started breathing in and I could feel just the jolts of,
yeah.
of,
Well, remember, my friend, I said pain is a warning system. So you're doing the opposite. You're telling your brain and your body that actually there's nothing to be scared of right now. I'm in a very calm and very pleasing state.
uh,
How could you be warning me about something when I'm in this calm and relaxed and
interesting because
pleasing?
it's such a basic thing to do too. I was just thinking like, I'm taking Motrin anti-inflammatories for it, but like with breathing, it literally is, you can do it anywhere at any time. And, you don't necessarily, it's just one of those things that we just don't think about all the time. Like that should be the first step, right? Is doing that.
Yeah,
It's just, okay, let's check in with my body, check in with what's going on,
that's
and
right.
where are the pains coming from?
That's
Okay,
right.
that we haven't done like a mind, body, and spirit check-in in a minute, but
We have not done that in a minute. I know.
but it's okay.
It was a great journey through chronic pain, and
Pain
I just
management.
want disclaimer again, like everyone's pain is different. Like if you take this for educational value, but if you have pain yourself you're experiencing, it's best for you to discuss that with your healthcare provider. And I'll link some of the resources I mentioned in the show notes, because I think those are really good resources to consider. And yeah, we'll keep talking about it, Poe, because I'm curious to know now if you start incorporating breathing and really kind of acknowledging maybe some of the emotions that you might be feeling and how those might be contributing. Your
100%.
pain's not going to go away completely,
Yeah.
but it's like that dial. It's like,
Yeah.
whoa, I dialed my pain down in certain areas that I didn't even realize.
Oh yeah. Like I'm 100% like, now I'm like, okay, why haven't I been doing this? Like why haven't I been doing and for whatever reason, busy, but now is the time to start getting connected with that again. Cause literally in that minute,
So this is great, Poe. This is why we call it a health feast, because I think anyone, we talked about with Jay, like people can look at something like meditation or doing breath work as something I should do. Oh, it's good for me. I should do it. I heard it helps lower my blood pressure. I heard it helps my anxiety. But I often will do a minute of breathing with you, like now, or with my patient, because I say right away, I want you to see how it feels good. I want you to see and experience how it feels good, so that next time when you think about doing it, you're not doing it because anyone told you to do it. You're doing it because you want to, because it feels good. And then you're going to do more of it, and you're going to do more of it. And it's just going to compound. The effect and the benefit is going to compound because you're doing it consistently. And why are you doing it consistently? Because it feels good.
and to add to that, I think your attitude has a lot to do with it. Like me talking to you this morning, I was like, look, I'm at this point where I need to figure out what's going on. So I was open and curious enough to, let's just do the meditation.
Yeah, you were open and curious. You
Yeah,
were open
because
and curious.
if you go into a situation thinking nothing's going to work, then you're absolutely 100% right. It's not going to work. But if you go into me coming like, I got to be open to any suggestions you were referring, to me about taking deep breaths. And I honestly, like, I think after we're done, I think I might just take do another 2-3 minute reading
There
session
you go.
before I got to go. Um, just so
Please.
that, and even doing it in the car, like I have to go to an appointment. I have another doctor's appointment at 1 today. And it's like, let me just do it before I get out. Cause it's usually
Love it.
standing up and that's when I usually feel the most of it. But if I can just practice just being mindful of the pain, which is something really
Yeah.
big for me, I think I'm going to start doing that and breathing into the pain versus restricting it.
Oh, I'm doing I think this will air after, but I'll do it again for my new telehealth. I'm doing a free breath workshop.
Okay.
Um,
Tell everybody
that
about it.
Yeah, well that'll probably already have happened because it's gonna be in the middle of December and we're recording this in early December, but I'm sure I'll do it again. So you, well, my just tell people about my practice,
Yeah, yeah,
which
yeah.
is Rock Your Life, RAK, Dr. Rock, RAK, your YOURLIFE.com. And I'm a lifestyle medicine physician, as you know, and I'm licensed in 10 states. So you can work with me and I can be your lifestyle doctor. I can help you, for example, if you have chronic disease, help you come off medications by really addressing the root cause through your lifestyle. And I'm also your coach. So I'm not just your doctor, but I'm also your coach. And so there are membership options. I do not accept insurance, so it's all membership based because it includes more than just appointments with me. Really, like firsthand access to me. I would say there's a personalized app that you can message me. And then beyond that, we have groups. We have what I call tribes. So these are coaching groups. These are not medical appointments. These are coaching groups, but health and well-being coaching. And we're helping like-minded people who, like when I say like-minded, these are people who all want to take control of their health and level up and do it in a supportive environment. So there's the really three pillars of these groups. There's support, and that comes from support from me and group support from all the other tribe members, and then accountability. And really, at the end of the day, you're only accountable to yourself, but having partners and a tribe and me is what helps with that accountability to yourself. And then guidance, right? Because I think like a lot of times people are sort of like, I want to do the right thing, but there's so much out there, there's so much noise. And so I really rely on what the evidence shows and what I think is best holistically for our body and our mind and our spirit. So, yeah, it's been a lovely, we just started last month and it's been an incredible experience so far. And I'm really looking forward to bringing more people in. So, check out the website and oh yeah, and I once a month I do a community workshop. And so if you're curious or you want to like kind of learn more, you can attend one of those community workshops. And just go to the website and there's a sign up page. And the theme changes every month. So one is on breath work, but there's one on plant based eating. There's one I did what I call the knowledge action gap. So how do you cross that bridge of doing what you know you should be doing? Yeah, and there's different offerings that I will add over time. I also have a newsletter, and so I'll put that link down there below in the show notes. That's it. Yeah, thanks, Poe, for giving me
Yeah. All right.
a minute to tell everyone about. If you made it this long about chronic pain, then you can hear about some of the things I'm doing.
Well, Rock, is that it for today?
I think so. Yeah, that was a good conversation. We'll see you guys here next time. You can visit us at thehealthfeast.com and you can send us a message or something, a question that you would like answered potentially on air. Happy to answer questions or perhaps a topic that you'd like to see covered. And yeah, we'll see you all back here next time. Take care, Poe.
Have a good one.
Bye.
Bye.